Hi, I'm Tom. This is Wheelchair Wellness, and I want to remind you all that we don't have to walk to be well. I have a spinal cord injury and have been paralyzed from my chest down for over 20 years. I have also been a licensed occupational therapist who specializes in spinal cord injury for over 10 years. The information in this video is for educational and general information purposes only. Everyone's needs and abilities are different, so please check with your own healthcare provider, therapist, or medical team before making changes to your routine, exercises, or equipment setup. Thank you, enjoy the video, and support disability in your community. Today, we are going to be talking about spinal cord injuries and the bed. So your bed is where you spend a third of your life. Some people may spend a little bit less, some people may spend more. The main idea is that we spend a lot of time in bed. So we need a bed that works for us, and we need to know how to safely move and utilize our bed. Some people may not know the basics, and that's okay. But I want to make sure that everyone does know the basics and they know how to do the basics safely. So what is bed mobility and why is it important? Bed mobility is how you move in bed. And it's important because it's the first thing you need to do to get out of bed. These are the first things you need to do, is sit up in bed and get out of bed and into your wheelchair. If you can do those things, then I think that you're on your way to doing a lot of things for yourself. And that is a very important thing to understand early on in an injury, that you have what it takes to be independent. And if you're able to do bed mobility independently, sitting up in bed, getting your legs out of bed, doing your leg management, transferring from your bed to your wheelchair, all of those things are basic building blocks to independence in a wheelchair. Because once you're independent with these things, you can start working on more and more complex things that we'll talk about in other videos. I only have a mat where I do these videos. I wanted to have a bed and a mat, but I don't have room. I just have room for a mat. So I will try to give you some more videos of my own bed at home. But for right now, I'm going to show you these on this mat. On the mat, it's a lot easier than in bed, but I do all of these in bed too. To roll safely and to make sure you're not damaging your back or the hardware in your back, you need to make sure that you are rolling with your legs crossed or with one leg bent. Because if you roll the bad way, I'm going to demonstrate the bad way with just like reaching over and trying to pull yourself over like that. That puts a lot of pressure on your lower back. And that can cause damage to your spine if you're twisting too much. If you have hardware in your lumbar or thoracic spine, that can break the hardware rolling like that. I know people who have had to have their hardware ripped out and replaced because they rolled like that because nobody told them not to. So please, especially if you're newly injured, remember to bend that leg and roll. So how do you do that from laying flat? Well, let's see. So I am incredibly lucky that I have long arms and I can reach my legs to bend them up while I'm laying down. A lot of us, if we sit up, we can reach our legs to roll. So that's the next thing. How do we sit up? So there are multiple ways to sit up from lying on your back. Again, I have no abdominal muscles. The first and the easiest way to sit up from laying on your back, if you have abdominal muscles, a good amount of abdominal muscles or strong enough abdominal muscles, is to just sit up with your abs. Like a sit up. Now, I can't show you that, but I mean, you can envision that. You just sit up. I'm using my arms, but it would look a lot like that without using your arms. How do I get up? This is how I just got up. So I put my hands under my hips or my butt, and I use my biceps to curl myself forward and to sit up. Now, after I get to here, I put those elbows back. Here's another way to sit up. You can use your arm momentum. So sometimes I will put my arms up here and just throw them forward as hard as I can. And that will cause me to sit up, and I can put my elbows back behind me. And then I push myself up from there. The last way, I don't really think about it, but this is what I do most of the time now at home. I started with those. So now, whenever I want out of bed, I grab the side of my sheet and I just pull. So I do pull my sheets off a lot, but there's always something, whether it's a mattress, the mattress cover, or the sheets, that I can grab onto and pull myself up. So those are the ways that I get up. So to go back to rolling, if you can't reach your legs to bend one of them before you roll from laying down flat, you need to sit up somehow, bend that leg, roll either to your side or all the way over to your stomach. So this is a bed ladder. This is all a lot of people need for help with bed mobility when they can't do it themselves. If you need something more supportive than this, and if this isn't enough, I think a bed railing that fits under your mattress is the next step. But this is all a lot of people need. So with the bed ladder, you want to make sure the bed ladder is long enough that you can reach easily whenever you are laying down flat. And you want to make sure that it doesn't slide down. So you need to make sure it's positioned right. So a lot of people can just use both hands and pull themselves up with it. Now, for people without hand function, that's not going to work. A bed ladder will also help with some things if you don't have good hand function. So you don't have to, with this, you don't have to hold it with your hands. You can hook your arms. You can even hook both arms in it if you want to, and pull yourself up that way. And then get yourself on an elbow and then start scooting your legs or sitting up. The next step is managing my legs. One thing about leg management that I will say is that it gets a lot easier with time. So the more you manage your legs and the more you struggle, the stronger you get, and the longer you don't move your legs, the lighter they get because they lose muscle. To move my legs, I virtually always use the back sides of my hands and I just move them under my knees. So I'll either grab with my palm or with the back side of my hands, and I will just kind of push my leg over. And again, on the mat, that's a lot easier than in the bed. I do it pretty easily in bed now, but a lot of people, for leg management, if you can get under your knees with one arm and just kind of turn your body and put your legs off the mat that way, that's how a lot of people do it. Or just one leg at a time, up, up, down, down. So you guys can't really tell this right now, but I'm sitting on the edge of my mat. I want to talk real quick about when I would and when I wouldn't sit on the edge of my bed like this. I obviously sit on the edge of my bed like this every day when I'm transferring to my chair. There is a second or two where I'm not, my hands aren't on something and I have to balance for a second or two. But that's virtually it. Like, there is never an instance where I'm just hanging out like this. Now, that is because I have no abdominal muscles or no lower back muscles. and I'm very unstable. Like, I need a backrest to help me feel stable. If I lean some way just the wrong way, or if I do something wrong, like, I'm going down. So I'm a T1 spinal cord injury. So I have no use of any abdominal muscles in my body. For those of you that do have control of even a little bit of your ab muscles, it is very beneficial to sit edge of bed without any back support and just play around. Like, try to lean as far as you can this way without your hands. Try to lean as far as you can that way without your hands, and then right. Try to lean as far as you can forward without your hands. Try to lean as far as you can backwards without your hands, and then right. I can't right, but hopefully a lot of you can. That is a very easy way to strengthen your abdominal muscles. And if you have abdominal muscles from somebody that doesn't have them, please utilize them as much as you can and get them as strong as you can, because it is so hard without abdominal muscles. Please use them if you have them, and please strengthen them if you have them. I'm begging you. As an occupational therapist, I hear far too many people that after their injury, they just lay in bed all day. I get it. I've had a spinal cord injury. I understand that after a spinal cord injury, you don't know what to do. But the biggest thing that I want to get across in this video is that once you're in inpatient rehab, you should not be laying in bed all day unless you have a pressure sore. Like, having a pressure sore is the only excuse I can think of. I'm sure there's more. If you're doing it for any other reasons, it's hurting you more than it's helping you. Orthostatic hypotension is when you sit up and you get lightheaded. That is caused by your blood pressure dropping because it's not used to you sitting up. So if you lay down for too long and you don't sit up enough after that, your blood pressure can drop, and that will make sitting up virtually impossible. So by laying in bed all day, you're basically making sitting up harder and doing what you need to do throughout your day harder, just because you're not getting up from bed and sitting up. If you just got injured in the last month or 2 or 3 or 4 or 5 or 6 or however long, and you're still laying in bed all day and you have full use of your arms, it's not good for you. You need to try to sit up and get out of bed and figure out what to do during the day besides lay in bed. Laying in bed is not the answer. Laying in bed will not help you with anything besides heal a pressure wound. However, it is very important to lay in bed and get off of the wound whenever you do have a pressure sore. If you have a pressure sore, you have the excuse to be in bed. Like, that is what you need to be doing to heal that pressure sore. If you don't have a pressure sore and you have full use of your arms and more, or just your arms, get out of bed, please. It's not doing you any favors to be laying in bed all day. We all lay in bed for too long when we get first injured. That's why a lot of us have orthostatic hypertension after our injury. But by sitting up in our wheelchair throughout a lot of the day, that usually helps our blood pressure regulate. But if we're laying in bed all day, our blood pressure never regulates, and it will always drop whenever you sit up. So please get out of bed. Start sitting up as long as you can. You need to be able to sit in your chair for hours at a time. I sit in my chair for 12 hours or more a day, and I get a lot done because I'm not in bed. I'm getting older, and I do go to bed and stretch and kind of relax more than I used to, but it's only for a few minutes here and a few minutes there. I'm not laying in bed for large portions of the day, and I recommend that you guys don't either. You should be sitting up in your chair trying to get your blood pressure regulated, especially if you have blood pressure issues. So what do I use my bed for? Most importantly, sleep and intimacy. I don't have a mat in my home, so I use my bed to stretch. It's a lot harder than a mat, but it's all I have at home. So that's what I use, and it does a good enough job. Stretching is definitely harder from a bed than a mat, but by fighting the bed, you actually strengthen your balance muscles. And stretching on the bed was really hard for me the first 2, 3, 4 months I did it, and then it just got easier and easier and easier. And then I got a more firm mattress, and it got even more easier. I still feel like I get a better stretch on a mat, but I can do what I need to do from my bed. And I don't have a mat at home. I just have a mat at this clinic. So I don't use a mat at home. I just use my bed, and I do a lot of my stretches and even exercises from my bed. I want to specifically mention tummy time. So anybody with a child knows what tummy time is. It's very important for people who sit in wheelchairs throughout the day too. Whenever you sit in a wheelchair, your hips get tight, your hamstrings get tight, and laying on your stomach helps stretch all those muscles out that kind of get tight from sitting in a chair. So I recommend laying on your stomach for at least a few minutes a day, if not more. I actually sleep on my stomach. If you have hardware in your back, specifically your lumbar and thoracic region, I would be cautious about tummy time, but it's usually still possible. You just have to be careful. I would definitely be talking to my therapist or doctors about how to stretch safely if you do have hardware in your thoracic or lumbar region, and especially if you're fused all through there. Just know that tummy time is important, but it's also important that you're cautious figuring out how to safely roll and how to safely stretch on your stomach. This is something that's very important that I do in bed every day. I think tummy time is so important that I've started to even sleep on my stomach like this or like this. And then before I get out of bed, I will get up on my elbows and sit like this and work my way up even further to here. I get a good stretch on my hips, my back, and my abs. Those are all things that are tight and get even tighter with time. Before you do that, if you have any hardware in your lumbar or thoracic regions of your spine, you need to consult with your therapist or doctor before you do that. Because the same thing can happen there as when you roll. If you have hardware in here and you're stretching that part of your spine where it doesn't want to stretch and where that hardware doesn't want you to go, that hardware will break. And that will hurt, and that will waste a lot of your time waiting for surgery and getting surgery and resting and recovering from surgery. So when you're rolling to your stomach, always start low. If this causes sharp pains, you need to get out of that position and roll back to your back. If you're doing it for the first time, just please be careful. Know that laying on your stomach is a very important stretch after a spinal cord injury. And stretching on your elbows and then up into a push-up position can stretch even more, but it can also be dangerous depending on what hardware you have in your back. From this position, I also do some exercises. So the first exercise I do is push-ups. Or I guess these are modified push-ups. If you've never done push-ups before and you have hardware in your back, in your thoracic or lumbar portions of your back, consult with your medical provider. So I do push-ups and I do back exercises. So back exercises are really important to keep your shoulders healthy. So you might not think your back and your shoulders are the same thing, but your back muscles and your shoulder muscles overlap, and your upper back muscles play a big part in the stability of your shoulder. So the back exercises I do from this position are these. I'll probably do a video more in depth on that later. But those are the back exercises I do. I do push-ups, those back exercises, and then I get out of bed and do pull-ups. Tired. All right, so what type of bed is best? That's a question I get a lot as an occupational therapist. I think the best beds are definitely wheelchair height, so you don't have to transfer up or down. I think the best beds for most people are semi-firm mattresses, not too hard, not too soft. Some people might prefer even a firm mattress. I know some people are more comfortable on softer mattresses, but if this is your spine and you're laying on a soft mattress, so your spine will actually curve into the soft mattress, and that's not good for your spine. Like, that will cause back pain and just tightness in areas you don't want. So if you have a firm mattress, your spine sits flatter on that mattress, and that's better for your back health over time. And it's also a lot easier to move around on, to stretch on, and to exercise on. So that is why I recommend a firm or semi-firm mattress. I have always had semi-firm mattresses. A few years ago, my wife and I bought a Sleep Number. It was super expensive, and I don't know, I might do a video about it someday. But there are things I like about it and that I don't like about it. My cheap semi-firm queen mattress, I still prefer to the Sleep Number, honestly. But the Sleep Number is nice because you can make it softer or harder, but I usually just keep it on the same semi-firm setting that I've always used. So I don't really ever change it anyways. Beds are important, but just know you don't have to spend tens of thousands of dollars on a bed. I also want to talk about hospital beds and not hospital beds. If you're able to do some bed mobility before you go home, you don't need a hospital. You don't need to rent a hospital bed. If you can sit up from supine and you can roll, I don't think you need a hospital bed. And I think that it's kind of a waste to recommend that when people don't need it. I think that some people may need hospital beds after they leave inpatient rehab, but I think the majority of people do not, especially paraplegics. Because also, what people don't talk about at hospital beds, like, it's really hard to roll onto your stomach on a hospital bed. They're small. You can't really roll, you can't exercise, you can just lay in it on your back or on your side. And as people with spinal cord injuries, we need more than that. We need a bed we can roll onto our stomach. We need a bed that we can do some exercises on. We need a bed that we can do some stretches on. That's another thing, the stretches. Doing stretches on a hospital bed that's an air mattress or like a soft mattress is impossible. Unless you need an air mattress because you have pressure sores all the time, you probably don't need an air mattress if you haven't ever had a pressure sore. If you've never had a pressure sore and you're still on an air mattress, I would talk to your healthcare provider about getting a different mattress. Something that you can stretch on, exercise on, sleep comfortably on. It just makes you rely on the hospital bed. And if you're a paraplegic and you're still using a hospital bed 6 months after your injury, I encourage you to ask yourself, why do you still have a hospital bed? And can you use something else? Can you use a normal bed? I think some people do need hospital beds, but I think there are far too many people with spinal cord injuries on hospital beds that don't need them. And if you're a paraplegic and you're on a hospital bed, I encourage you to talk to your healthcare provider and see what they recommend to get you out of the hospital bed, because it should be possible. And unless you just love the hospital bed and you just don't want to get rid of it, I think that you need to be working towards a normal bed. Here's what I recommend to assist with bed mobility if you're having trouble doing these skills. First, a bed railing or a bed ladder. This will help with sitting up in bed and with rolling. It'll give you something to grab onto on one side that you can help sit up with or roll. Another thing is a wedge. You can use a wedge to help you sit at an angle like you would with a hospital bed. So I have a wedge right behind me, and it's a valuable thing to have, and they're not very expensive. Lastly, leg lifter straps. Leg lifter straps can help with leg management, which is very important in bed mobility. Thank you guys for listening. And remember, the bed is not just for sleeping. It's your training ground for independence. Up next, I'm going to do a deep dive video like this about transfers. Thank you. Everyone have a great rest of your day. Peace. Get out of bed.